All right, this is the video log for question 11, 12, and 13 for a patient with de Quervain's syndrome. So question 11 is what manual technique would be appropriate for this patient? Went with passive range of motion, maybe some mobility of the tissues in the wrist, and also some joint mob. So as far as moving the tissues and the ligament or the tendons affected, it's just going in one direction, picking up that thumb, and then going in that same direction over and over. This can promote tissue healing. Also would recommend icing afterwards. Another thing we could do is just passive range of motion. So something the patient would do. So he can move his wrist in flexion extension like so, abduction, ulnar and radial deviation. Also, because the thumb is affected as well, he can do the same thing for flexion extension, abduction, and adduction like so. So he's moving on his own, not moving into pain or anything. He could also do active range of motion as well. So this will help maintain his range of motion, so no contractures are formed at all. So he can do all the same movements actively. Joint mobs may be beneficial too if he feels like those decrease pain. So sticking to the joint line and mobilizing like so, which may help with his wrist movements as well. What exercise would I prescribe? He can do, like I mentioned, active range of motion would be beneficial, but to progress from there, we can start with isometrics with him just using his hand as resistance. So making sure that there's no movement itself, but he is actively working those muscles. He can do wrist extension, flexion, ulnar radial deviation, as well as all the thumb movements as well. So that's just using his own resistance. After we do isometrics, we can work towards eccentrics, so slowly lowering that against resistance. So you can do that just with gravity, like so, not letting gravity take over. You could also do that with resistance, just letting it slowly lower. Again, all wrist and thumb movements. We can work eventually towards using weights and bands. This should be non-painful after the pain has subsided after 2 to 3 weeks. So as far as a therapeutic device, we don't have a thumb spica splint available, so we can tape to help with stabilizing his wrist and thumb. So I'll show you how to do that real quick. First things first, just making that base tape, anchor tape. Like so. So it's important when you're applying these thinner strips to not get it into the web space, because that can be irritating. So what we're going to do, start on that anchor tape, going around and not getting to that web space. So it kind of looks like a teardrop. Perfect. And then we are going to do a second strip, right? Go in the opposite direction. In the same direction? Same direction. Making sure it is nice and secure. And then the last thing we're going to do is get another tape just to secure those other pieces of tape. So this should help pull that thumb a little back and reduce any pain if there is any, and just keep it nice and stable.